What I think Loma Linda offers here is, for me as a provider, was a chance to work on the cutting edge. They gave us these opportunities that very, I think few centers would ever allow their practitioners to do. You know, the robot got FDA approval for gynecology in the fall of 2004, and in the spring of 2005 we were already starting our training, and in the fall of 2005 we actually did our first case. There's very few places, I think, that would allow providers that cutting edge technology in this area.
When we do minimally invasive and specifically robotic assisted surgery, people who first see that do think that it looks a little bit like playing a video game. We have a console that we will look into, kind of like the old Viewmaster that you remember seeing, and that allows us to look in almost like we were inside the patient's body, and that will give us a good three-dimensional viewpoint of the patient's problem on the inside. And then we use some hand controls underneath the viewing port that allow us to move instruments inside the patient's body. So in many ways it's kind of like a video game, and that technology really enables patients to have surgery done with very small incisions.
When robotic surgery first came out, it wasn't being used for kidney surgery at all. And I saw one of my colleagues presented a series of patients he'd done robotic partial nephrectomies on. A partial nephrectomy is a very complicated, one of the most challenging operations that we as urologists do. The kidney is so vascular, every time the heart beats, 25% of the blood coming out of the heart goes to the kidneys. If you make a cut in the kidney, it'll just start bleeding and can make it very hard to see. So I think one of the major advantages of robotic surgery is you can very precisely place your sutures, sew up the blood vessels in a very rapid and controlled fashion, sew the kidney back together again in a very rapidly consistent way, and get an excellent outcome. So it has really allowed us to apply minimally invasive surgery to an organ where before the robot it was very difficult to perform laparoscopic partial nephrectomy and very few people could perform it.
We tend to think of a robot as independent, but in this situation the robot is a tool which is essentially an extension of the hand, miniaturized, able to go deep inside the body to do complex operations. Robotic surgery is a major advance in terms of the technical ability to do complex urology cancer surgery. What it does is it allows miniaturization of essentially the human hand to be put into the body through punctures instead of making a large incision, and to do complex work such as a radical prostatectomy with a minimum of cutting, scarring, blood loss, and it really, that minimization or minimally invasive aspect tremendously speeds recovery.